Katie. I'm Dr. Matt. I'm the hospitalist here in this clinic. So let's go ahead and see what is going on today. I know that the previous doctor who admitted you in the emergency room was here and checked on you, correct? All right, can you please go ahead and verify your first and last name and your date of birth?
March 20th, 1990.
Okay. And your last name, Katie?
ASMR.
Okay. Let's see. So you do have here quite a few allergies. And those are checked. Okay, and I see here you have the reason as a strep throat infection. Okay, how are you feeling today?
Still pretty bad, but it just feels really raw, and it just feels like really heavy in my throat.
Okay.
And it really hurts to swallow.
And does it feel a little bit better compared with yesterday?
A little, yeah.
So how much in percentage would you say it went down?
It's gotten like 20% better.
20%.
Yeah, it was really bad.
Okay, well, that's definitely not as much, so we can't discharge you today, but hopefully tomorrow we'll reassess, and if you feel better, you can go home on just by mouth antibiotics. Right now you are on IV medication, and I see here that your last antibiotic was about 4 hours ago, so you're due for another one in 2 hours. So we're going to increase the dosage on that actually, and from 500 milligrams we're going to go ahead and do 750 every 6 hours. And you do have some steroid medication. Have you noticed any palpitations?
No.
Any sweating?
A little sweating at night.
Sweating more than usual, right?
Yeah, like when I wake up, I'm sweaty.
Okay. And have you noticed any edema, any swelling in your hands or feet?
Not that I've noticed.
Okay, so that's good. And you said no palpitations. Have you noticed that your breathing is slowing down?
Not really. No.
Okay. So no more breathing. Are you able to eat and chew food?
It's really hard. Like especially eating and swallowing food. Liquids are a little better.
Okay. Is there anything in particular that you would like us to do better on your stay here?
I don't know. Just continue like what's been going on. I mean, it has been getting better, but
Okay.
maybe I don't know.
Well, if you feel that you would like us to do something a little bit different, just let us know, okay? The nurses can get in contact with the doctors 24/7 here.
Okay.
Okay. I would like to check your heart and your breathing first. Okay. I'm going to open the gown. I'm going to slide the stethoscope under the gown and just listen to your heart. Okay, I can hear only S1 and S2. No S3, no S4. Okay, the medication that you're on could cause some heart problems, so I want to make sure that there is no valve abnormality as we go forward with the treatment. I'm not going to increase the steroid medication dosage. We're going to keep it as it is, and hopefully it's going to help with the inflammation to slow down. Go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. Take a deep breath in. And exhale. And again, breathe in. And breathe out. Are you coughing a lot at night?
No.
You said you're feeling some sweating, grease sweating.
Yeah.
Okay, we want to make sure that we don't develop any pneumonia while we're here in the hospital. Breathe in. Breathe out. And again, breathe in. Breathe out. Okay. Go ahead and say 99.
99.
Again, 99.
99.
Okay. Okay. I'm gonna go ahead and palpate your neck. It might feel a little bit sore. So go ahead and tell me if you feel anything. Sore. Okay. So the CT scan did show some abnormal inflammation in the back of the neck. And the reason for your admission is that we were concerned about your breathing, that all of that inflammation would really press down on your trachea and not allow you to fully breathe and oxygenate your body. It seems like the inflammation is slowing down. Okay, tonsils do feel a little bit swollen still. Not as bad as yesterday. Yeah. Do you have thyroid problems?
No.
Anything running in the family?
Not that I'm aware of.
Okay. I'm not feeling any lymphadenopathy. Okay, now I'd like to check the back of your neck as well. See if I'm feeling anything. Okay, I'm not checking the spine. What I'm looking for is any signs of cystic adhesions or any inflammation that could be pressing down anterior on the trachea and really not allow you to breathe properly, especially laying flat. Okay, I'm not feeling any retroesophageal abscess. Very good. Okay. I'm gonna put this on your index finger. Go ahead and relax. And let's see if you still have a fever. You came in with a low-grade fever. Okay, so you still have a low-grade fever, 99.5, and your oxygenation is very good. No concerns there. 97% of room air, and heart rate is also good. 71. Perfect. Okay. I'm going to take your blood pressure too. So this arm, I'm going to use it. Okay, I'm going to have you uncross your legs for me, please. Okay, go ahead and relax. Okay, blood pressure is a little bit low. We might have to increase fluids. How are you feeling? Any dizziness?
Sometimes when I stand up really fast.
Okay, that can happen in the hospital, so just try to increase fluids and drink lots of water as you stay here with us.
Okay.
Blood pressure 98/60, and I'll have the nurse come in about an hour to recheck and make sure that it's not going lower than that. Okay, so now it's just that moment where I have to check your tonsils and see how much inflammation is in the back of the throat. Okay, go ahead and give me a big say all right. Okay, so still a little bit red and swollen. I can see the classic signs of strep throat. It's gonna be there for a while. I would say about 3 to 4 days, even on antibiotics. So no concerns there. Let's go ahead and check your vision as well and see if there is any edema or anything concerning there. I see that you're wearing contacts. And do you have everything that you need with you here in the hospital to remove them safely and clean them? Okay, good. If you do need anything, just let us know. We can accommodate that as well, okay? We want you to be safe. So go ahead and look straight in my nose. Okay. I'm going to press down on your eyelid, see if there is any yellowish discoloration. Go ahead and look up. Okay, so no signs of any liver problems. Okay. I'm gonna have you look straight behind me at this wall, and I'm gonna do a retinal check. Okay. No inflammation behind the retinal. Seems like there's no interstitial fluid. Okay. A little bit of redness, but might be just caused by a lack of sleep in the hospital, which is very common. Alright, and I will check your nose as well. Go ahead and look up for me. Okay, turbinates look good. There's no redness there. Okay. Okay. I'm going to go ahead and check your corneal reflex. So I'm going to have you look straight at me and I'll gently touch the side of your eye. We're looking for blink. Okay, good. And we're looking for the same reaction, blink. Very good. Was that painful?
No.
Okay. All right, and I'm going to create a vibration sound. We're checking your ear, see if there is any fluid buildup that may be caused by this upper respiratory infection, bacterial infection. Can you hear it? All right, tell me when it stops. Okay, slight delay there. Can you hear it? Tell me when it stops.
No.
Okay, so on both sides might be some fluid build up in there. Let's go ahead and check your ears. I'm gonna have you look that way. Okay, tympanic membrane is pearl gray, but there seems to be a little bit of fluid leaking from the left ear. And that's not normal, that's definitely abnormal. And let's go ahead and check your other ear as well. See if there is any leaking the way your left ear looks. Well, not so much leaking in this ear. And the tympanic membrane is intact, so doesn't seem to have any orifice of any fluid leaking. Okay, and have you noticed any abnormality with your smell while you're in the hospital?
I usually have a not so good sense of smell, but I haven't noticed a change.
Okay. All right, let's go ahead and give this a try. Okay. So this is a very basic smell. I'm gonna have you close your eyes and tell me what this smells like.
Lavender.
Yeah. Okay, so smell olfactory nerve is intact. I'm gonna give this a try as well. This is to test your taste. I'm going to put one drop on your tongue and I'm gonna have you identify it.
It's like sour cherry.
Okay, so it is sour and it has a little bit of sweetness in it. Let's go ahead and see what else we're missing. So we need to do a head to toe exam. Okay, we did vision, ears. Okay, we're missing scalp. We did throat, nose, and neck, so that's good. All right, I'm gonna go ahead and do a scalp check really quick, see if there is any inflammation there. Okay, now it may seem that the scalp cannot be related to a strep throat infection, but sometimes people may develop hives and other signs of allergic reaction, especially to the medication that we are giving you on the scalp area. And have you noticed any kind of itchiness?
A little bit. Like just behind the ears.
Behind the ears?
Yeah.
Okay, we'll get there as well. Okay. All right, I'm gonna have you lay down and I'll start examining your abdomen, okay? Okay, any problems with indigestion? Okay, any abdominal pain?
It's been hard to get food down because of how it hurts to swallow. So
Okay.
no, not a lot.
All right, I'm gonna go ahead and put the count down a little bit, and we're going to first auscultate. Are you passing gas?
No.
Okay. Okay, diminished sounds on the right upper and lower sides. Okay, so we are concerned for some obstruction, but hopefully it will not get to that. You do have to drink a lot more fluids. And try to get some walks on the hallway. The nurses can help you walk if you struggle with that. And sometimes just carrying the IV pole with you, it really helps to hang on to something. Okay. Going to gently palpate. Okay, abdomen feels soft, which is good. No reason to suspect any intestinal obstruction. Just continue to maintain intake of fluids. Very good. I'm going to have you turn and I'll take a look at your back. Go ahead and tell me if you feel this on the left or right.
Left. Right. Left. Left. Right. Right. Left. Right.
And tell me if you feel this equally on both sides.
Yes. 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 Yes.
Alright, I'm going to touch you with two textures. One is going to feel sharp and the other one is going to feel dull. Go ahead and tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Okay. Going to palpate your spine. I'm looking for any inflammation. Looking for asymmetry. Very good. Going to check your legs for any edema. Have you noticed any swelling in your legs?
Yeah, not that I've noticed.
Capillary refill is within 2 seconds, so that's a good sign of peripheral circulation. Pedal pulse is 2 plus. Very good. Pulsations on both sides, strong, and synchronizing. No pedal edema. Okay, I'm going to check your reflex. Go ahead and relax your foot. And the Babinski reflex on the left foot. Okay, good. And now go ahead and tell me if you feel less sharp or dull.
Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull. Dull.
Okay, I'm gonna have you wiggle your toes on both sides at the same time. Okay, I'm gonna have you push with the pads. Push my palms. Good. Okay, a little bit stronger on the left side. I'm gonna have you pull your toes towards you. Okay, good. And now push with the right heel. Push. Good. And push. Good. Okay, perfect. I think we're gonna have you here in our hospital for another night at least. So we're going to continue for another 24 hours dose of antibiotics and anti-inflammatory IV medication. It's crucial that we continue treatment before we send you home. And everything looks good, heart and lungs, so I'm not concerned about any adverse effects from your medications that you're receiving here. And the fact that you have a lower grade fever, it's also a good sign, okay? So just try to relax as you are going to be with us for another night, all right? If you need anything, just let us know.
Okay, thank you.
Do you have any questions for me?
No.
All right, I'm gonna let you relax and I'll come back and I'll see you tomorrow morning.